welcome to another episode of Transform 360, where we dive into conversations that inspire, educate, and empower us. I'm your host, Sabar Shad, a pharmacist, mental health advocate, and your guide to personalized well-being. Today's episode dives into a powerful conversation, rewriting the narrative of masculinity and mental health. And still in this age, why do so many men still feel ashamed to say, I'm not okay? Why is the vulnerability still seen as a weakness, and how can we start changing that perspective together? Joining me today is someone who's not only passionate about this topic, but deeply involved in helping men reclaim their mental health with compassion and courage. Dr. Kokou-Abi, a psychiatric mental health nurse practitioner with an incredible background. Dr. Abi earned both his master's and doctorate in nursing practice from Vanderbilt University School of Nursing. His doctoral project focused on polypharmacy of anxiety medications in an inpatient psychiatric setting. He's worked extensively with patients navigating mood and thought disorders, anxiety, and so many other mental health conditions. And beyond his clinic, his research interests included substance use treatment, reducing stigma, and improving access to psychiatric care for underserved communities. And if that wasn't enough, he's also served as a clinical assistant professor at UT Health Houston and Texas State University's nursing programs. And outside of his professional life, he enjoys spending time with his family, playing tennis, and unwinding watching the episodes. Dr. Kokou-Abi, welcome to our episode 9, and I'm so glad you're here, and I'm looking forward to our conversation.
Thank you for having me, Saba. I'm really happy to be here.
That's amazing. So let's begin at the core. What do you think? Why so many men struggle in our community to open up to things like anxiety, depression, or burnout, and why in this age does shame seem to be tightly woven into that?
That's an interesting question. When we talk about the shame that men feel, or lately there seems to be a shift, a perception that there's a shame in mental health. I think this is not a new issue, right? There's more light that is shone onto it these days, but it has been there for ages, right? There is a societal perception, societal lack of patience for men who show vulnerability. That is the root of the problem, in my opinion. I listened to a talk by Brené Brown. I don't know if you're familiar with her. She's really well known in the mental health community with her work. She's amazing, and she was giving a talk when she talks about writing a book discussing mental health, and a man approached her and say, "What happened here?" And I don't hear anything that sort of pertains to me. And she said, "Well, I don't research men." And he said, "Well, how convenient is that?"
Yeah,
Right.
yeah.
Her thing is, show me a woman who can actually sit with a man with vulnerability and with fear, and I will show you somebody who have actually done incredible work, right? We have this discomfort about men showing vulnerability and men showing fear, and had the perception of being unappealing or being what a man is supposed to not do, right? I think that's where the part of the issue is
Yeah.
that causes shame. The other part is what I see as lack of representation in mental health when it comes to men, right? The therapy approach, or the sort of approach that work for women, for example, does not always work for men, right? When men are seeking help, most of them, right? I can speak for all men, but in my experience, most men want a solution-based approach, and they not that they don't want understanding and compassion like other people do, but the approach is more solution based. And when we give them understanding and we give them compassion and all that's all we're offering, that can be perceived as condescending, which doesn't really advance their agenda or make them comfortable in being open, right? For example, right? We talk about black men do therapy in barbershop, especially in this culture here, right? Why is that? Because the approach there is solution focused, is representation, is people who look like you who are talking about issue that you are familiar with, and it just seems to relate. So that's what I think the part of the issue is. And also societal perception that this is what men are supposed to do, and sort of like a mismatch.
That's true, and I hope that societal perspective changes, because I think that just puts so many pressure, especially on men. Like the same way you said, they have to act in a certain way. Even from communities where we come from, as people of color, right? Men are told not to cry, just to toughen up, and we don't always realize how those messages misplant themselves at that time, and years later they show up in isolation, burnout, and so many other problems. And I know you do have a practice, Dr. Abi, where you see all kinds of people who have mental health problems. So if you could just talk a little bit more, and you don't need to give a certain percentage, but do you see more men and seeking help?
Yes, yes, that's fair. Originally, I see a lot of, like any other psychiatric practice, we see a lot of female, right? But then they come and they say, "Hey, my husband needs help," and then a lot of the men that I see are sort of like spouses, right, or siblings of patients who are already established, and that's how most men in our clinic are able to like get involved with us. But we think that, okay, men are not really receptive to getting help or to getting mental health or to talking. But once you're able to start talking to them and you're able to build that connection and build that rapport, you will be amazed about how much men want to be heard and want to share their issues and want to just be vulnerable if they feel like what they're getting in return is meeting their needs, right?
Makes sense. Yes.
And I think on that point, it's not just an issue of men versus women, it's about anybody. When
Yeah.
they approach, and I talked earlier about representation and how representation matter. That is not to say that only men can give good care to men, right? That's not what I was saying at all. It means that the approach that you are giving have to be something that resonates with the other person, right? I work with a lot of women, and the approach that I have resonates with them. I also work with other women that my approach doesn't resonate with them. So men come in, when they come in and you're able to like build that rapport with them and give them what they need, no reluctance whatsoever for them to share. They actually share more than women. You'll be surprised.
That's true. Then sometimes people, when they really open up, they would share stuff that you're not expecting them to share. That's true. And my next question would be on the same thing: therapy around men. We still hear things like therapy is not for me, or I just need to deal with it on my own. I'll figure it out. So how can we challenge that belief that asking for help is somehow unmanly?
Hmm. Well, I think asking for men, we know that asking for help is not unmanly, right? Maybe the better approach will be in how we phrase it and how we approach that conversation with men. We know a lot of people want to have, like I said earlier, a solution-based approach, because there's a perception out there which is wrong, that when you go to therapy or when you go seek mental health care, it's because you have a serious mental illness, and that won't be far from truth. Right, in our society, background wise, we have community support, right? There's a lot of I'm from Africa, we have a lot of community support, right?
Mhm.
And a lot of problems are solved in communities. You have your family, you have your brothers. In this individualized society, it's not the same, right? And reframing the therapy narrative or the mental health care narrative in terms of having that community support, but it is better than your community support because it is an unbiased and is a professionally enlightened approach, makes it better.
That's true. Yes, that's true. And I think everyone should just go to therapy at certain point in their lives, make so much different in their perspective and whatever they're dealing with.
And they just need to heard that, I'm not going to therapy because I am mentally ill. Everybody needs some level of support. We all do, right?
We all do.
Healthy or unhealthy, we all need some support,
That's
right?
true. And I think seeking therapy is very healthy, because we all just need support, and there's no shame in reaching out, no matter how old you are, how young you are. If you're a teenager, it doesn't matter. And I think the same thing, like therapy is not a sign of a weakness, it's a sign of emotional intelligence, resilience, and you choose to heal yourself or whatever has happened, but you just focus on yourself getting better. Yeah.
Whatever has happened, and if nothing have happened that you are aware of,
Yeah.
right?
Yeah.
Talking to somebody who might look like you, who might have a perspective that you have, that's a powerful thing where you build a community
Mhm.
of biased opinion givers who are able to, like, kind of support you in whatever journey you're on.
That's true. That's very powerful. And
It would be great if counseling professional schools, medical schools, nursing schools are
yeah.
able to do a better job at recruiting diverse sort of, like, set of candidates, right? Where people of all background are able to have access to the education and are able to have access to the care and give into their communities, right?
That's true.
Um, yeah, it doesn't always, and this might sound bad, but it doesn't always work well to have underrepresented populations seek help from something they can't really relate to.
That's true. You're very right because sometimes it happens because for us, we belong from different communities. We represent different cultures, right? And if I talk to someone that has no idea of what my background is or what my culture, moral values are, then I am not going to open regardless of whatever is happening. Yeah,
Hmm. Hmm.
that's
Right. Yeah.
and based on how we're talking about the societal rule. So if you could rewrite one societal rule about being a man, what would you change?
That's a tough question. Rewriting one societal rule about being a man. Well, how about we rewrite one societal rule about, not just being a man, a societal rule in general, right? Where we say it will be ideal to have a society that is void of the um, gender normative roles that we have, right? Because in my practice, what I see oftentimes is that for a lot of people, this is what causes some of the mental anguish that they have, right? A man's supposed to be a provider, a man's supposed to be strong, a man's supposed to be X, Y, or Z. And when you have somebody who is not able to like step into that role and to fill that role, there's a sense of shame and there's a sense of guilt that they carry, right? But maybe that's not where their forte is, right? A woman is supposed to be maternal. A woman is supposed to be caring. It's supposed to be kind. And it's supposed to be all of these things that we have that are preconceived ideas, right? Maybe a woman wants to be a provider. Maybe a woman wants to be the leader or the head of the sort of like, the family unit. Or maybe that's the natural inclination. Maybe the man natural inclination is to be a homemaker and to be supportive and to do all of these things. I feel like an ideal society will be one in which everybody fits into the role that comes naturally to them, right? Where we don't have the perception that you have to be this because you are X, because you're a man, you have to be this, because you're a woman, you have to be this. I feel like that causes a lot of anguish and that causes a lot of, you know, dissonance with who people are.
People are. That's true, and that's a beautiful be right. I love it. Like, I appreciate your perspective. I understand, and they're carrying so many pain in silence that they were never given permission to express it. Yeah. Another question would be based on on your incredible and vast experience, Dr. Ravi. You have dedicated your career to psychiatry, advocacy, and education. So, what made you choose this path, and what was your why?
So my why was, it goes back to when I was in nursing school. Being in nursing school and having multiple rotations, right? We do OB rotation, we do med surg rotation, we do psych rotation. And during my psychiatric rotation, we were at a local psychiatric hospital here. We were assigned to patients that we were supposed to follow during the day, document all the intervention that happened with them, and kind of like, report back at the end of the day. My patient who I was assigned to was this very large black man that I was followed, and I sort of bonded with him, right? But at the same time, I was seeing sort of like how he was being treated on the unit. He was on the acute unit, right? And I would go to lunch, and him and I would just sit down and talk, talk, talk. And then I would go to lunch, and then I would hear that there's a code, and and I would come back and run back, and he's like on the chair. They strap him down, and then they give him the shot, and then they put him in the isolation unit. And I was like, what just happened? I just was just here 1 minute ago. And then when I see how the psychiatrists and the staff were talking about this person, felt so like this is not the person that I was talking to, right? Why is he having a different sort of like, behavior and approach to me? And with other people, his demeanor and his approach is different, right? And I kind of felt like maybe this is what I'm supposed to do, where people who look like me are able to see me as a calming presence and able to confide and able to like seek that sort of like, help that they need, right? Um, so that was my why. And along the line, I have wonderful mentors who were able to like, you know, inculcate that sense of responsibility, that academic excellence that we strive for, right? That need for research and need for, advancement in the career. And yeah, that's how it started.
That's incredibly moving, and thank you for sharing that story and sharing your powerful why. It's so clear that your work is not just professional, it's also personal. And thank you for doing what you do. And as we're nearing end, wanted to ask you, what is one message that you would like to send to every man who's listening today to take to heart?
Well, the message that I would like to give people is whatever you feel like you're dealing with, whatever you feel like you are struggling with, there are professionals out there who have lived experience of the same things, who are able to understand you and who are able to talk to you without you feeling out of place. So reach out. You'll be surprised. And I think this goes to the, in therapy or in the mental health world, there's this taboo from practitioners where self-disclosure is not something that they are comfortable doing, right? But I look at that in my practice as something that is really powerful in terms of making your client know that you have the same perspective, you have the same struggle, and sharing that with your client make them more comfortable. So my message is, we get it, we understand it, because we have the same struggle that you are. Yes, we are on this other side of the table. Doesn't mean that we're not patient also, because we are, right? I'm also somebody's patient, right? I go to therapy, and we all need that help, and we all need that sort of like, working together to kind of like, better ourselves.
That's true. Thanks for sharing that. That's so powerful. And as you mentioned in your practice, could you share maybe a website, or where should they reach out to you?
Yeah, the clinic is called Baobab Psychiatric Services, and we have one location here in Round Rock, and we have another one in South Austin.
Perfect. Thanks for sharing that. Okay, and I love this last one. This is like a rapid fire round.
All right.
I know you weren't expecting it. Yeah, just say whatever comes to your mind. If you don't feel comfortable answering it, just say pass. So the first one is, what's one morning ritual you absolutely can't skip?
Morning ritual.
Mm-hmm.
I have to take a shower in the morning.
Okay.
Otherwise, I don't feel like I'm awake.
Okay. A book or quote that completely shifted your perspective.
Oh, I use this oftentimes with my clients. It's Audre Lorde. I don't know if I can remember it correctly, but it says, if I don't define myself for myself, I will be living according to other people's fantasy, and I'll be eaten alive. Something like that, right? It goes to making sure that that people pleasing personality doesn't show up, and that you are who you are, right? And that's why you don't conform to what people's perception of you should be.
That's amazing. That's amazing. What's one thing you wish every man knew about himself?
Know who you are, know your blind sides, right? Know what makes you feel uncomfortable, know what makes you feel vulnerable, and own that.
Perfect. When you are stressed out, what's your go-to way to reset?
I play tennis, and I also watch The Office.
Okay. Okay. One fictional character that you may secretly relate to.
I should say this, but if you watch The Office, I think Dwight is who I wish I was.
Okay. 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 I love all of your answers. They were perfect. And you have been such a joy to talk to, Dr. Ravi. And thank you for your wisdom and energy. Today, to all our listeners, today's conversation was a reminder that rewriting manhood is possible. It starts with questioning the stories that we have been told and replacing them with truth, tenderness, and the strength rooted in healing. And thank you so much, Dr. Kokou-Abi. Thank you for being the part of the change and what you do every day for your patients on a daily basis. I'm so honored to have you in this episode. And thank you, everyone, for tuning in. If this episode moved you, challenged you in any way, or made you feel seen, please share it with someone that you care about. Leave us a review and follow us for more stories that heal. Until next time, take care of yourself and stay balanced. And thank you so much again.
Thank you, Sabah.